how does age affect vision? Essentially, anti-aging of the eyes is looking at the processes that rob us of our vision and finding ways to prevent it. By the time we've lost our vision, our retinas are dead. It's too late. We need to act way before that. The big one is cataracts. And we already have anti-aging for cataracts. It's a surgery. You go in, you take out your lens and you put in a new lens. What exactly is a cataract? If you look over here, you can see that's a clear lens. That black hole is a pupil. Behind it sits a lens, like a round lens, which is clear. But with time, the lens gets cloudy and looks like that. I don't know if any of you have seen in some dogs, you have a look at them, their eyes look like that. Because they don't get cataracts done. Most human beings don't wait for that. We're not going to wait. Because by the time that happens, you can't see anything. But in between that, it starts to get cloudy. And this is how it starts to look. That's sharp vision. This is cataract affected vision. It just gets cloudy. We're all going to get a little bit of cataracts. So now the key is, okay, we can wait until the end, and when it's nice and ripe, we can pop it out and put a new one in. It has its advantages. It also helps to, when you get your cataract done, it immediately removes your short-sightedness, which is pretty cool. Because they put in a false lens, which can accommodate for your glasses. So you won't need glasses anymore, which is nice. But you still need reading glasses, correct. There is no prevention at this stage for age-associated presbyopia or long-sightedness. You know, the having trouble reading and the arms not long enough, maybe that's all the way. We don't know. We don't have a way to prevent it. But cataracts you can prevent. What causes cataracts? Ultraviolet damage. That's the biggest one. The biggest preventable cause of cataracts. You shouldn't go out in the bright sun or in ultraviolet without sunglasses. And those of us that have regular glasses for short-sightedness, most of us get an ultraviolet tint. I've got a UV tint in mine, so it will protect me from ultraviolet. And it's unlike UVA, which causes most of the skin damage and the aging of the skin. UVB is what causes cataracts. So you cannot put sunscreen on your eyes. You can put it on your eyelids, but you can't put it on your lens. So you can protect it with a decent ultraviolet. We had diabetes was shouted out at the back. Diabetes is number 2. Between those two, sugar and ultraviolet, you've got most of the cataract effect. And then there's bad luck, genes, lack of antioxidants, because it's really built up the free radicals in the lens, which then cause the cloudiness. What you're actually talking about is the whole heart attack, stroke, diabetes spectrum. So, number 2 way to prevent cataracts is don't let your arteries block, don't let inflammation build up, and don't let your sugars go up. And the best way to prevent diabetes is don't eat any of those cakes. Sugar, 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 carb, 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 the old story. It's not fat, you know. Fat is also last year, you know, the whole fat avoidance. The latest studies have been showing that excess fat or fat in the diet is not what's causing the heart disease. It's the sugars and the carbs that are making us fat, and that obesity is then leading to the heart attack, stroke, diabetes. So keeping lean and actually looking through this audience, you're a pretty lean bunch, I must say. Most of us here are actually lower than the North American average, and Canada is lower than the States. But that doesn't mean that we're not going to get cataracts. Still, keep the carbs down, keep the exercise up. Those are the 2 major ways. So it's the same old, same old. The way to prevent dying, aging, diabetes, cancer, heart attack, and cataracts is stay fit, stay healthy.